Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call. Hey everybody, my name is Di McQueen and I'm a licensed clinical social worker and addiction specialist. And I'm joined today with my partner and dear friend, Dr. Brian Jackson, who is also an addiction specialist. And we're kicking off our new podcast called Healing Families Shattered by Addiction. Brian and I have been in the addiction world, working clinicians for about 30 years combined. And over those years, we, time and again came up against the family who was in so much pain. They're usually the ones that would call us. They would come to a session and just be in excruciating pain, not knowing what to do, how to do it, and feeling actually rather broken. So, we decided that this was an area that didn't have as much emphasis as we felt it should. And so here we are, healing families shattered by addiction. So, Bri, I know you can relate to this, and I also want to kind of know what kinds of things did you see that were, specific to family members that were, going like, you know what, we really need to help these people.
Yeah, thank you, Di. It's good to be with you today. Addiction is something that affects the entire family. And there's so many resources out there for the person who is suffering from the addiction in terms of inpatient treatment, intensive outpatient treatment, individual treatment, Alcoholics Anonymous. And I really felt that the family doesn't have as many resources to try and cope with how they're feeling. What I've seen over the years is family members are just full of anxiety. They're full of frustration. They ruminate about the person that's ill. They kind of have their happiness contingent on that person getting well, which a lot of times happens. But in the meantime, It's such a frustrating, confusing place to be. It's consistently inconsistent, which is difficult to live with. So we really looked at what can we do to help the families? How can we coach families to be able to run their lives, not be preoccupied about the person who's ill, and try and enjoy life in spite of the fact that you love the person that's suffering, but you need to love yourself. And I know that sounds cliche, but there's tools and techniques that we can give you to reduce your anxiety, kind of tap it down to where it needs to be. So Di, I mean, we've talked about this, and I'm real excited about it because really where we've been focusing is on the patient or the loved one that's suffering. However, the phone calls that we were getting over the years were from family members, and family members would come in and see us. Unfortunately, we couldn't spend a ton of time with them because we were focused on the person who had the illness. And time again, the family was so sick, and I don't mean sick, physically sick, but emotionally suffering, mentally suffering. And a lot of times that does lead to physical suffering. Di, I mean, has that been your experience? I know we've talked so many times, and staffed after we met with family members in terms of what can we do to help them?
Absolutely. I mean, I think it starts with, let's start at the beginning, right? Which is, I had my own addiction issues, and then I married an addict, and the pain, when I was going through my own stuff, like, you don't really realize what you're doing. So it's, you don't really think about the pain that you're causing others, or the stress or the magnitude of what you're doing and how it affects others. But when I was on the receiving end of that, wow, right? Like, I mean, I was brought to my knees and not really having coping mechanisms to deal with the discomfort that I was feeling and the control I was trying to exude, right? And it wasn't working. Anything I tried wasn't working. So we see it daily, right? On, people coming in and they have said, I haven't slept in 3 weeks. I'm physically feeling like I want to throw up. I can't keep focused at work. I'm chasing them around. Oh my God, I've been following them with their telephones and they're, and figuring out where they are. And I walk into a bar and I'm pulling them out of the bar and I'm acting crazy. And I have no idea why I'm doing all these things. And so we, started being able to help them with some of these tools, but in the time frame that we were working with addicts, we really didn't have a lot of time to be able to sit down and really spend the quality of time or help them understand that they were as sick, if not sicker, than the person that was actually afflicted by the addiction. And when you start to help them peel back the anger, the frustration, the sadness, the fear, it was amazing to them. They start to come to light and going like, oh, you mean there's actually things that I can do? And I do have some control over me, not them. And, it's really exciting when you see people begin to come to light. And I know for you, Bri, I mean, you can relate to the same kind of thing. You kind of grew up that way as well.
Yeah, I grew up in an alcoholic household, and, everything, as I said earlier, was consistently inconsistent. You never knew what was going to happen or who was coming through the front door. And it was a source of a lot of anxiety for me, even growing up as a child, as a teenager. And I swore that I never personally would get involved in that type of lifestyle or drink like that. Unfortunately, I did start drinking, and it was a nightmare. And I ended up going to Betty Ford back in the year 2000, February of 2000, as a matter of fact. And it wasn't that Betty Ford healed me, because I'm now in my 23rd year of recovery. It was just that I had willingness, that my head and my heart had come together and said, Brian, you are an alcoholic and you do need help. And that's what I did for me. However, the families that we work with right now have to be able to do that for themselves. I mean, there was a possibility that I never would have gotten help But it wasn't until I decided to get help, and there was nobody that could have made me get help. And I think that's really the frustrating part for families. And I think there's a lot of embarrassment and shame that go along with that. And you don't want to admit to other people, your friends, your family, that a loved one, is drinking too much or taking drugs and having serious side consequences as a result of that. So the purpose of our program is to help you realize that you're not terminally unique, that this is really widespread in terms of how it affects the families. I've rarely seen a family that hasn't been affected by the disease that their loved one is dealing with. So, our focus is to coach families to help you get through this really, really difficult time and give you tools and techniques. Obviously, just based on what Di and I have told you, our personal disclosure of living with this can help you. I really believe that because we've lived it, we've learned it, and now we want to teach it to you. And so that's really the focus of our program. And with the advent of virtual and Zoom and everything else that's out there in terms of being able to reach people, we felt that now we can reach people from all over the world, because this is universal. It's not just one area of the world where this is happening. So Di, in terms of the program, how do you see it evolving in terms of help to families and what we can do to help families?
Well, I think, for our program itself, we're going to, listen and tailor make the program that's necessary for that particular family. And we do that by, our first initial consult, just getting to know the family and what exactly is happening. And then we're going to teach tools and techniques, things like how to set a boundary, how the ripple effect affects everybody in the family. How do you get your power back? How do you stop the external wheels from turning nonstop in your mind? And that and many more. I mean, there are some very limited resources, things like Al-Anon, which I happen to love. But Al-Anon is one area that you can use. There's books, there's other podcasts and that type of thing. However, there's nothing quite as effective when you're in the throes as having, real one-on-one sessions or family sessions where you can actually sit and really dive into how this works within the family nucleus of that particular family. So, and it is different for everybody. Everybody's situation, even though there's, universal tools and techniques, it's not that a tool and technique works for that particular family. You have to kind of figure out which ones work for you. And so we're really looking forward to that part of it. And, each week we'll be having guests on that will have, various areas of expertise in the addiction world, family counselors, what exactly is the disease of addiction. We're going to start with that next podcast, as a matter of fact. But there's lots of different techniques. We might have an interventionist. We may have somebody who understands, different areas of interventions that are working today that are out there for people that can work through these different, survival techniques, for lack of a better word. But I think we're really excited about the customization of the programs that we can do and the far-reaching accessibility that we have now with this new virtual world. So, I mean, that's really, our goal is to help these families that feel so broken, as we know with our podcast, Healing Families Shattered by Addiction.
Yeah, and I think that as a family member, you get comfortable being uncomfortable. You fall into this role and say, okay, I'm just going to have to live with this way, as uncomfortable as it is. So our goal is to get you to where you're comfortable being comfortable in spite of what's going on around you. And we want you to get back on your feet and give you tools and techniques that you can live with, that are going to make you less stressed, less anxious, and to embrace the fact that this is a disease. And I think Di mentioned this, that our next podcast we're going to talk about the disease concept. You can't cure people's diabetes. You can't cure people with you love with, of their heart disease. And this is an illness, and you're not going to be able to cure it on your own. It's the one disease that if the loved one decides to get help, that they can keep it in remission, and they can keep it in remission for the rest of their life. So again, there's tons of hope, and we have seen so many great outcomes for families, great outcomes when you stop interacting with the addict or the alcoholic the way you have been, because when you stop doing that and they see the changes that you make, sometimes it's an aha moment for them, saying, wow, they're not being distracted by this anymore, and they're not, enabling me anymore. So that's the goal, is for you to get better without the expectation that it's going to make everything perfect, but it will make it a heck of a lot better. And I'm really excited about that. So you can come to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. We've got a lot of information on there that you probably can relate to. And again, Di mentioned earlier that we have a free consultation with you to see what exactly is going on and if we can help you. And if we can, we're going to come up with a tailor-made program for you. So please contact us. You can also contact us via email at info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. Send us any questions that you have, and we will get back to you. So I look forward to it, Di.
I do too. I can't wait. And there's nothing better than when you see someone who has been hurt so badly to heal. So come join us every couple weeks on Healing Families Shattered by Addiction. Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.